Many of my patients often ask if there is a way to prevent knee surgery. Sometimes knee surgery is absolutely necessary, but often people rush into surgery when they don't really need to. I've seen patients push back and even prevent their knee surgeries, even when they're bone on bone, just using these technologies I'm going to show you now. Most people have either twisted, jammed, or torn something in their knee at some point in their life. Over time, the pain from the knee injury goes away, but its function's never truly the same. Eventually, the malfunctioning joint becomes hypermobile or sloppy and wears out unevenly. Then, at that point, the pain and swelling returns and the joint slowly self-destructs. There are two kinds of arthritis you can get in your knee. One is osteoarthritis or degenerative joint disease. This is caused by just wear and tear, like an old injury catching up with you. The other kind is much more rare. And the other is an autoimmune arthritis, such as rheumatoid arthritis or psoriatic arthritis. The way to tell them apart pretty easily is to check the distribution of the arthritis. If it's just in kind of one or two joints, it's probably wear and tear osteoarthritis. If it's systematically the same all over your body, like both knees hurt, both hands hurt, both wrists hurt, then that's much more likely an autoimmune arthritis. This is usually caused by a sensitivity in their diet where they're eating something they shouldn't be eating. One of the more common trauma and sports-related injuries is known as the unhappy triad. It consists of tearing the anterior cruciate ligament, the medial collateral ligament, and the meniscus. If they're completely torn, you're going to need surgery. But if they're only partially torn, there's a lot of things you can do to rehab and stabilize that joint and avoid costly surgery. If you want to manage your knee pain naturally, there are two areas you have to address: inflammation and stabilization of the joint. There are some common supplements that you probably know about that can help repair cartilage that's been damaged, like chondroitin sulfate, MSM, and knee lubricating oils. One of the new technologies that is amazing with inflammation are cold quartz lasers. And you can either go to a doctor for that, or you can actually buy your own. In the article I link below, it does show you more about how lasers work and how to get one if you want one. One of the most critical things you can do in knee pain is to stabilize your feet. I've never seen a patient who has knee pain that has good arches. Everyone I've ever treated had bad feet. I like this poster from Foot Levelers. It really explains how bad feet affects the whole body, from the shoulder to the pelvis to the knees to the ankles. But what you really need to take away of this is if your arch drops, it will usually cause pain on the same side in the knee. If your knee pain is ultimately caused by your bad arches, then you could do all the exercise or get all the chiropractic adjustments you want, and it's really never going to stabilize. The bad foot's just going to keep pulling the knee out of place. I recommend getting Foot Leveler CRA orthotics. They're the best I've ever seen to take care of knee problems in my practice. Usually you have to have a doctor get this for you, so just ask them for that. There are two main kinds of orthotics. There are kinds that make your feet feel good, and there's kinds that can correct structural problems. So if you go to the store like Walmart or whatever, and you're buying those usually just make your feet feel good, but they don't do much for structure. If you get the other kind, those are custom orthotics where you go to a doctor and have them made, and those can correct structure. They'll put the arch back in your foot and realign your knee and realign your spine. One important side note is you want to stay away from rigid orthotics. A lot of podiatrists will cast them out of plastic where they don't move. The problem is, this might make your foot feel good, but it drives all the force into your knee. You need a proper strike from heel all the way to toe off, and there needs to be flexibility in the orthotic. So you want a flexible orthotic, not a rigid, or you can develop even more knee problems. If you had really bad knees, say like bone-on-bone arthritis, you'll want to look into something called distraction. What this is it's kind of a traction unit that pulls the knee and opens and closes it. This allows nutrients to flow into the synovial capsules and joints and can promote healing of the joint. If you're on a tight budget and can't afford to go to a doctor for distraction, you can always get an ankle weight, hang the weight, and rotate your knee around like a pendulum. Gravity will distract and open the joint. Then alternate, putting the weight on for about a minute and taking it off for a minute, and maybe do a set of 10. If you've determined that your arthritis is because of autoimmune issues, then you really got to handle that through your diet. In the article I've linked below, it'll show you the best anti-inflammatory and plant-based diet I recommend. Just follow that link. And since we're talking about diet, the same diet also works really well for weight loss. Believe it or not, just 1 pound of extra weight causes a 4-fold impact on your knees. So if you calculate that out, if I walked a mile, that would be an extra 4,800 pounds of pressure I'm exerting into my knee joint just by gaining 1 pound. So even losing just a little weight can make a huge difference on your knees. Another useful method is to actually go to a chiropractor and get your knee realigned and put back into place. Minor misalignments can really wreak havoc on the knee, and chiropractors use various different techniques to address that. Once you get your knee stabilized by the chiropractor, sometimes a brace is a good idea, and also exercise. Once the joint's stable enough, I find the rebounder, especially this brand, the Cellular Sizer, is very good at rehabbing sloppy knee joints. Be sure you get a quality rebounder. The cheap ones will pronate your feet and cause even more knee problems. If you have a lot of nerve pain, tingling, or numbness in your knee, this device is really excellent. It's called a rebuilder, and besides being just a regular TENS unit, it has a bunch of other excellent features. It has an EMS pulse, the TENS unit, but the most important is the 7.83 frequency, which promotes nerve healing. So if your nerve's damaged, it can actually strengthen the nerve and help a lot with those symptoms. I hope this story helped give you some new information on dealing with knee pain. And remember, you can get much more detailed information at the article below. Just click that link in the description. Thanks. Don't forget, if you haven't subscribed yet, please subscribe to my channel. Also, give this a thumbs up, a like, a share, or if you have something to add, remember to comment below. Thanks. Also, don't forget to stop by TerranLupo.com. I have up videos that you can't see anywhere else. All you have to do is go over and sign up at TerranLupo.com, and all that's free.